Just checking with Dr. Kelly Cam. Can you hear us, Dr. Cam? Okay, well, we'll circle back to Kelly here in just a few minutes. I want to emphasize a couple of other things as we're working through this here on our first one. You know, there's really a lot of information out there this evening, a lot of information coming out daily and weekly. Things are changing, and it can be hard to keep up on all of that information. That's really one of the reasons we wanted to put this town hall on, was to have experts come in, highlight what they know, what information is changing and emerging, and even importantly, highlight some things that we don't have all the answers to yet. During the town hall tonight, there'll be an opportunity to send in questions. For those of you who are on the Zoom, you can send those questions using the Q&A function at the bottom. If you're listening on the radio, you can email us your questions at townhall2020@mtu.edu, and we'll do our best to answer those questions throughout the program, and especially the second half of the program. Next, I want to bring in Dr. Karen Helt. As I mentioned before, Dr. Helt is the director of the Health Research Institute on campus, and she's also a professor in the Chemical Engineering Department. So Dr. Helt, we really appreciate you being on tonight, and thank you for joining us.
Well, thank you, Steve. And I definitely want to start by thanking Dr. Steve Elmer and Dr. Kelly Cam for setting up this great series about the COVID-19 impact and response. They saw a need to inform people of the different aspects of this pandemic, and I'm really honored that the Health Research Institute could be a part of it. HRI at Michigan Tech started in April of 2019, and since then we have been striving to provide a thriving environment that promotes translational, interdisciplinary, and increasing convergent health-related research, and inspire educational and outreach activities. Health research on Michigan Tech's campus has been growing over the past 5 years, and we hope that having a centralized location on campus to bring together different departments and ideas will help increase this growth. One example is this town hall series. We're excited to be a part of this great educational and outreach activity to help our community better understand the multiple aspects of the pandemic. HRI has been a part of several aspects of Michigan Tech's response to the pandemic. Kelly Cam has been instrumental in guiding the school to their back to school plan for Michigan Tech. Many of us have assisted in setting up the operations of the COVID testing lab on campus. And there's been other research projects that have been initiated in testing wastewater to detect COVID-19 outbreaks and other antiviral and vaccine related projects. There are so many aspects to this pandemic that we still don't completely understand. There's the science behind the virus, how it spreads, but then there's also a lot of economic costs that have been occurred due to this pandemic. And I really hope that this town hall can help highlight a lot of these things for our community. They're going to hit on many of these things and more, and HRI and Michigan Tech are tackling many of these big issues needed in the response to the pandemic, and I'm extremely honored to be a part of it. So thank you, Steve and Kelly, for the invitation.
Well, thank you, Karen. And Karen, you're actually going to be back on the program here in just a couple of weeks, coming up on September 24th, when we're talking about the virus transmission, the testing, the tracing, and also vaccine development. Now, I don't mean to put you on the spot, but if you go to mtu.edu at the moment, you are front and center. Can you just give us a preview on some of the work that you're doing related to vaccines?
So the focus of my lab is on vaccine manufacturing. And so there's many different types of vaccines, and they're all made very differently. And so some of the goals of my lab are creating ways that we can make large amounts of vaccines faster and distribute them quicker to the community when needed in large amounts. So that's a lot of what we focus on. And so our lab doesn't design the vaccine. We are engineers, and so our goal is to be able to make a lot of it when it's needed.
Thank you, Karen. Again, we look forward to having you on in just a couple of weeks. I think we've worked out our technical difficulties here, and I want to welcome in my colleague and co-host, Dr. Kelly Cam. Kelly, thanks for being here tonight.
Thank you very much. So I wanted to give a quick introduction to what we're going to go over today. So today's session will be a basic introduction to how SARS-CoV-2, which is the virus that causes COVID-19, how that spreads in a community, and the role of our public health agencies and healthcare practitioners to slow down and halt the spread of this disease in order to protect the health of our communities.
Well, thank you, Kelly, for the preview tonight. Just tell us a little bit more about how this idea of the town hall came to fruition over the past several weeks.
Well, it's been something in our mind since the spring, and since we saw the impact of this virus on all of our lives, including our students' lives and our community's lives. And given the immense amount of information out there and the constant changing of the information, as Dr. Helt has so aptly put it, that the science of this is the scientific method in progress. It's in real life. And so there's constantly changing information, because as we know more and more about this disease, we can update our information. And we felt that this being able to provide information about what we do know and what we don't know could be of use to both our students at Michigan Tech and our larger community.
Okay, and Kelly, I know tonight the focus is on the role of public health to protect the community. Could you give us a preview for what's coming up, over the next few weeks and really over the next couple months, as we'll rotate our topics every week? We'll have a different topic on.
So we'll have quite a variety of different speakers. The goal of this is really looking at both the impact and the response to COVID-19. So we have things as varied as medical practitioners that can talk about the impact on short and long term on the body of particular people who are infected, as well as things as diverse as what Dr. Helt had also mentioned of the economic impact of this virus on our community. Many of us have been working from home, or many are still working from home, and although we may have particular ergonomic equipment at our office, when we moved home, we did not have that equipment at our offices, and many of us did not even have a home office. And so there are impacts on our physical health of people who are not affected with COVID-19. So we're really trying to look at a very broad and very diverse set of impacts of this virus on our lives.
Okay. Well, thank you, Kelly. And as I mentioned before, when we were working out a couple of things, you really have a dual role tonight as a co-host. I really appreciate it. It's not easy being up here, right, as we know. And you're also going to be a presenter and helping us start off our first kind of introduction here to public health, and setting us up for our subsequent speakers from the Western UP Health Department and our nurse practitioner here tonight. So I'm going to turn it over to you to help kick things off.
Thank you very much. All right, so if we have the first slide.
1 second here. There we go.
All right, so just a quick glance at the current numbers from the World Health Organization, that we have almost 26 million cases of COVID-19 across the globe, and over 850,000 confirmed deaths from COVID-19. And pretty much every country, area, or territory in the world has been affected by this. There are, I believe, a few that have not been, but they are very, very rare and few between. So can I have the next slide, please? So as I said, SARS-CoV-2 is the virus that causes the disease we know as COVID-19. Now, in some people, COVID-19 is a mild disease that lasts maybe 10 days. Some people experience a very severe disease that can lead to death, and some people never show any symptoms at all. But yet these people are still infected, and they're still able to spread the disease to others. These other people who get the disease from someone who never shows symptoms may experience either mild or severe disease, or like the people they were infected from, may never have any symptoms at all. The virus is spread from person to person. That means that when someone coughs, sneezes, talks, sings, or otherwise creates droplets from their nose or mouth, which then enter another person's nose, eyes, or mouth. This can happen directly when you're close by someone who coughs without covering their mouth, or it can happen indirectly. An example of indirect spread is someone sneezing into their hand and touching a doorknob without first cleaning their hands. Then you touch that same doorknob and pick up the virus on your hands. You can become infected if you touch your mouth, nose, or eyes without first cleaning your hands. However, we can interrupt this virus's spread by staying physically distant from each other, so the virus can't travel directly from person to person, cleaning our hands to prevent both contamination of objects around us and transfer from a contaminated object to our faces. It's also really important to practice what we call proper respiratory hygiene, which is covering your mouth or nose with during a sneeze or a cough with a tissue, or into your elbow, and then cleaning your hands or your elbow immediately after. Now, not everyone who comes in contact with someone who is sick will become infected, and we can't predict who among someone's contacts will get sick, but some will. The average number of people who get infected from one person is known as the R0. And you may have seen this, or if you've ever watched the movie Contagion, this is often brought up in that movie. R0 is a really important number in the spread of a disease in a community. If the R0 is high, the number of cases in a community will grow very quickly. But if the R0 is less than 1, the disease will actually burn itself out in a community. So if the R0 is equal to 2, then that means that from one person, 2 more people will become infected. Each of those 2 people will then infect 2 more, and so on. And so you can see how quickly it can spread within a community and really have a high number of cases very quickly. Now, the R0 depends on many factors, including how many people the infected person comes into close contact with each day. Are you going to work? Are you going out and doing things socially? Are you going to classes? The more people that you're in contact with, the more potential people you can expose. It also matters how many days that person who is infected is out in the community during the time they're infectious. If someone who is infectious is staying home during that time that they're infectious, they're not contacting very many people at all. There's also impact from both biologic and behavioral factors about both the infected individual and the people they come into contact with. Now, if you think about that, because these factors are different for different groups of people, so a retired community might have a very different set of factors in terms of their daily contact rate and their number of infectious days, as well as characteristics of both the infected and the contacts, than a group of preschoolers. So because these factors are different for different groups of people, the average number of cases that come from one case is also different between populations. So the R0 changes from population to population. And as a brand new virus, we're learning every day about the differences in the R0 in different populations and different settings. So when many of the states were under stay-at-home orders, our R0 was very different than what it is as they start to open. Can I have the next slide, please? So another important piece of information about this disease is the difference between the incubation period and the infectious period, and how these 2 periods are critical in the control of disease. The incubation period is the time between when someone is exposed to an individual with COVID-19 and when they develop symptoms. So this is in the orange on the slide. For COVID-19, this ranges from 2 to 14 days. About half the people will develop symptoms by about 5 to 6 days after they were exposed, and half will develop symptoms in the later part of that incubation period. Now, the infectious period is different, and that's the time when someone who is infected with the disease is able to spread the disease to others. This lasts at least 10 days and can be much longer. And it actually starts several days before someone is symptomatic, so people are able to spread the disease to others before they even realize that they are sick. So in order to prevent spread of this disease, we isolate people away from others during the time they're infectious. However, because they could spread the disease before they know they're sick, public health officials work to find the people who are already exposed and quarantine them. By quarantining these people away from others during their incubation period, we keep them from spreading the disease to others during their entire infectious period, including the time that they don't know they're infected. Now remember that quarantine period can last up to 14 days, so it's really important that we keep people in quarantine for that full 14 days, because we don't know who's going to become infected at day 13 and who's going to become infected at day 2. That is a very brief introduction to what some of the critical components of COVID-19 are in terms of the public health response. I'm going to now turn this over to Pete Berry from the Western UP Health Department to speak about how the health departments respond to pandemics and infectious diseases, and particularly COVID-19.
Let's see, we're working through here. Pete, whenever you're ready, we will have you go ahead and unmute, and we'll turn it over to Pete Berry from the Western UP Health Department. Go ahead, Pete.
Okay. Thank you. I really appreciate the information from Kelly, because I think it's going to make what I'm about to say, help make what I'm about to say a lot more sense to everybody out there. So to kind of describe what local health departments have been doing to respond to COVID-19, what I want to do is just kind of walk you through the arc of what we've done and what we've been trying to do since basically January, and just talk about some of the things that we've been up to and some of the places we've been since that point. So, this started for us in mid to late January, where we started getting information about this, this new disease that was something that was occurring, in another part of the world, and it wasn't something that was, an everyday conversation piece such as it is now. And we started to review plans, kind of learning about the virus, updating protocols. And that was, that's normal. We see a lot of these things come through in the public health world, and sometimes they turn out to be something, and other times there's something that we just discuss and kind of move past. And then in February, it became apparent that this wasn't going to be one of those flash in the pan situations, and that this was the real thing. And we started to do a lot of community outreach. Public information began thereafter, and we started a process of traveler monitoring and quarantining. And essentially what that is when somebody would come from an area where there was known infections, an area of the world, those folks were they were followed through their travel, and then they were linked up with a local health department where they wound up, and then the local health department worked with them to quarantine them until that 14-day period that Kelly mentioned was up. Through February, there was a fair amount of those travelers. And then into March, we saw cases in the US, cases in Michigan, lots more outreach, lots more education. And then we started to see cases locally, by the end of March. But the thing that changed in March was, we started to work a lot with hospitals on personal protective equipment. We started to work a lot with schools and a lot of outreach and a lot of education. But what occurred in March was something that, kind of changed the game for public health tremendously. And that was a series of executive orders, for school closures, and then the stay home, stay safe orders. And when you're a local health department and you're used to working under the public health code and a variety of other tools, and all of a sudden you have executive orders piling up on top of each other, it became very, very complicated, very time consuming, and it consumed a lot of our resources here locally. And in March, we had our first cases locally. March 26th, we had our first case in Gogebic County and the 5 counties of the UP. And then into April and May, we saw continued, low case counts, additional executive orders, constant churn and change of the executive orders. And, isolation, quarantine, these things became a little more common. But the case counts in the Western UP through that period still stayed relatively low. It wasn't until June where we saw kind of a re-engagement of the economy, a lot more travel to the area, and a lot more, kind of use the term seeding, like there was a lot more seeds that were brought to the Western Upper Peninsula. And when that re-engagement and seeding occurred, we started to see a lot more cases. And then after right before and the area around and after the 4th of July is when we kind of saw our explosion, so to speak, in Gogebic and Houghton counties. Houghton County trailed off after that, but Gogebic kept surging. And we saw a lot more isolation, quarantine, contact tracing, case investigation, a lot of churn through that. Into August, September, there's a lot of work now with the schools, the universities, re-engaging, getting everything back to a place where we feel like we're finding some level of normalcy, but still dealing with the disease in a different way. Executive orders, there's still restrictions, there's still things that change our daily life. But what makes this unique, what makes this disease unique and this discussion unique is the fact that there's no silver bullet, there's no pharmaceutical intervention, there's no vaccine, there's no treatment. So we have to rely on these very old school public health interventions, non-pharmaceutical interventions. So the quarantine and isolation piece that Kelly mentioned with her graphic there is really the only tool that we have to stop that spread. So, cutting that spread off after the first or second round is really important. And that's how you drive the numbers down in the community, is to get a hold of those folks, isolate, and then quarantine their contacts. What makes this different is the scale with which we're doing it. local health departments have had plans for, isolation and quarantine are very old methods. And, we have some experience with them, tuberculosis and different things where you have to, isolate the cases. But to do it on the scale that we've done it in the time frame that we've done it, we've literally isolated hundreds of cases. And I don't have numbers for you, but I'm sure we've quarantined, when you start piling them all up from the travel monitoring all the way till now, I'm sure we're well over 1,000, maybe over 2,000 people have been through that process. And, the primary driving force with this, another thing that makes it unique is human behavior. Our decision making is what kind of keeps this at bay, and our willingness to distance and wear masks and do some of these basic public health interventions are what makes this very unique. Because as the time drags on, as the period that we've been dealing with this pandemic drags on, people's willingness to keep that up kind of diminishes, and we have to keep trying to find new and interesting ways to kind of engage the community to get them to keep doing what they need to be doing. So that fatigue is definitely a challenge. So the primary challenges for us is the constant change driven by executive orders and just new information about the disease itself. Fatigue, like I mentioned, and then asymptomatic spread, which is an interesting piece of this, where people can be completely unaware that they have the disease. They can be walking around with it, potentially spreading it to others, and have no symptoms, no idea that they have it. Long-term concerns for local health departments, we're very underfunded long-term for decades, and this is not helping. And the concern we have is that we can rise to this challenge of COVID-19, but there's a lot of other programs that aren't getting the attention that they need, and a lot of other things that aren't necessarily being done in the community. So we hope that we can find a way to balance this as we move forward, because there's a lot of other public health interventions that are taking a back seat to COVID as we speak.
We did have a question come in already, and I wanted to pose this to you. We're talking with Pete Berry here from the Western UP Health Department. Fall is coming up, and there's been a lot of talk about both COVID and the flu. Can you just elaborate a little bit on how the Western UP Health Department is planning ahead for the fall coming up?
Well, we know there's going to be confounding illness in the community. So there's going to be a lot of questions about, the symptoms that I have. Are these COVID symptoms? Are these flu symptoms? And we're going to rely a lot on our healthcare partners to help us suss that out in terms of testing and figuring out ways to help people determine what do they actually have. So that testing capacity and the ability for people to figure out what it is going to be really helpful. But on top of that, we're doing we're launching into the planning process for vaccination. So we're hoping to have a robust flu vaccination season. There's going to be a lot of flu vaccine available. We're being told there's going to be a lot of flu vaccine available, and we're going to make strides to get that into the hands of folks that want it. So that's our one preventative measure that we really truly have for this fall, is to get the flu vaccine out into the community, and then to get folks educated about what these symptoms mean, and to stay home when you're sick, whether you think it's the flu or you think it's COVID. Sick folks shouldn't be out in the community, because we can drive down our flu numbers using these same interventions that we use for coronavirus that we would use for influenza.
Okay, thank you, Pete. If you're just tuning in on the radio on 97.7 The Wolf, if you go to thewolf.com and want to join us on the live Zoom webinar, you can do that and click on the link. You can send us your questions. We have a lot of questions coming in on the Q&A function at the bottom of Zoom, and also through our email at townhall2020@mtu.edu. Just want to take a minute and recognize our sponsors for tonight: UP Health Systems Portage, the MTech Smart Zone, and Upper Peninsula Power Company. Thank you to our sponsors. Next, we're going to turn it over to Robin Meneguso. Robin is a nurse practitioner here in the community. She also collaborates with the Western UP Health Department. So Robin, we'll turn it over to you to get the clinician's perspective. In just a second here, we'll get Robin on. Robin, whenever you're ready, take it away.
Thanks, Steve. So as you said, I'm a nurse practitioner and I work in family practice, and I've had a large role in our COVID response in our outpatient setting at our facility in the community. And so one of the questions that Kelly and Steve asked of me is just to talk about my experience as a healthcare practitioner, and also just what this has been like and working with the health department. And so I would just start by saying that when we first in March, when we really started to kind of learn that this was coming and that we really needed to be taking and making some major changes, one of the biggest struggles we faced was that we needed to determine the safety of who could come in the building and how do we see patients safely. It really was a huge change for us. And so we had to create all new protocols for how do we screen patients, so you don't just make an appointment and show up in our waiting room with a fever and a cough and you're sitting next to perhaps an elderly person with an immunocompromised state or a brand new baby. We really needed to take those things into consideration. And the other thing was that we actually, by executive orders, were also told we couldn't do elective procedures and things like that. So we had to start turning a lot of our in-person visits into video and telephone visits. And that was a particular challenge for some of our healthcare systems because they were not set up for the infrastructure and had not had training to do that. And so that did definitely create some very big challenges for us at the very beginning as far as just the safety of how to see patients. And also, how do we clean the rooms? How do we space these out? So how quickly can someone go in a room after someone who's been symptomatic be in that room? And also the PPE, and I know everyone heard about the shortages of PPE at the beginning, but even in places like we didn't have a lot of cases, we actually did have shortages as well, largely because the allocation of supplies were going to places that had more cases, but we still had to comply with the same amount of regulations. And so it made a lot of challenges for us. So how do we keep ourselves safe? How do we keep the patients safe? How do we keep staff safe? That was always kind of the big questions that we were asking ourselves. And so at the facility that I worked at, we actually created an acute illness clinic. And the point of that was that we wanted, again, to separate those sick patients who were coming in with some of those COVID-like symptoms to our patients who still needed to be seen. And one of the big challenges was that we still needed to take care of people. People still had ongoing health issues that weren't related to COVID. And so, there was a lot of unique challenges that we faced trying to kind of weigh the risks and the benefits to safety and also taking care of these chronic illnesses that people have. And so with the acute illness clinic, we had to, determine algorithms for, who needs to come into that clinic. And then one of our biggest challenges was testing. And again, this has been driven home for months and months about testing, but certainly at the beginning, we had no idea how much COVID we actually had in the communities because we had so little access to testing. And so I relied heavily. So I've been working in the acute illness clinic since March, since this began, and I had to rely on, if you have symptoms, I needed them to be in quarantine because I had no idea because I couldn't test. And so that was definitely when Pete and Kelly both talked about those kind of old school public health tools. That was really what tool we had. And so there was definitely a lot of, we need you to stay home. We need you not to go places. And at that point, we were staying home. So that was a little bit easier. But as Pete said, as our numbers went up and the economy opened, it did definitely create challenges trying to keep people to kind of follow those recommendations that we were given. So, challenges again, definitely the PPE continues to be an issue. I, in my career in healthcare, have never had to reuse PPE. And that was something we had to learn what was the best and proper way to do that. Again, who could be tested. And that changed very quickly at the very beginning of who we could test. So I kind of and for I was what was going on. So the pace of which keeping up with changes was nothing like I've seen before. And, we relied heavily on working with our health department. It was definitely, sorry, having a little sun coming into the window here. But we definitely needed to reach out to our partners at the health department to look for guidance, to look for support, to ask questions. And that was very helpful. I know I made many calls there. And Kelly, another question that she had asked me just to kind of respond on was, how is this different? And I would say as a clinician, what was so challenging was that if you look at that symptom list, I mean, the symptoms are so varied and they are so broad. And so as a clinician, especially in those early days when we didn't have a lot of data, we didn't have a lot of research, we didn't have a lot of guidelines to be going off of, it really was just trying to do the best that we could. You know, what was this person coming in with? What was our risk versus benefits with using certain medications that we were told, you know, perhaps could be dangerous with COVID, steroids and things like that at the very beginning. And so as a clinician, like I said, that created a lot of challenges. So, you know, what makes this difficult is that because it's a new virus and none of us have really seen that much of it before, it really was difficult to know how to decipher what was COVID and what was not. And this was all happening, just so you all remember, that it was flu, RSV season, when people are typically getting those common colds. And so I think, you know, I think we're definitely in a better place now, certainly with having a lot more research, having more data. You know, we've increased our PPE supplies, our testing is more robust. And also, you know, we have the ability now as we go back into a flu and RSV season, the ability to do those tests. And so that will be definitely helpful for us in order to help kind of delineate risk and how to determine quarantine and things like that. So those, you know, those were particular challenges as a person, you know, seeing patients coming in who are symptomatic. And that, you know, we had to face and that we all had to face, you know, just across the United States. And I would say, you know, in Houghton County, because we didn't have a lot of cases, we did not have the overruns in our healthcare systems like they did in many places. So for that, you know, I certainly was grateful, but it certainly wasn't an easy time and continues to have its challenges. So continuing to stay in close contact with the health department, continuing to stay updated on new data that's coming out has been really essential, even, you know, especially as a frontline clinician. So those were just some of the things that they had asked me to speak about. And, you know, I know there's some questions and I'm happy to answer what questions you have. So thank you.
Thank you, Robin. A question just came in, perfect timing here. You're talking about here at the end, the frontline healthcare workers. We can't imagine how physically and mentally challenging and exhausting. Are you worried at all about burnout for workers on the front line, and how can we best support you and them?
Yeah, so I mean, definitely, again, there is probably a big difference from the places that we're working and having completely inundated healthcare systems. And again, thankfully, that was not us here, but definitely there's a sense of burnout when we don't know, and there's constant change and there's policy changing all the time. And, you know, just again, like Pete talked about, that fatigue factor, you know, that people are sick of COVID. You know, I think we are all sick of COVID, certainly, but it doesn't change the fact that it is here and that it can be serious and that we need to take it seriously and all do our part. And so I think, you know, it's important for us to have community support, you know, by wearing masks and by doing the things that the public health officials are asking us. And because that really does help us as healthcare providers and people who work in healthcare systems. It helps protect us. And so sometimes I have this sense of like, oh, thank you, you know, thank you for wearing that mask. Thank you for doing this, you know, to protect me and to protect my family. You know, I'm grateful. Absolutely.
Okay. Our next question is from a student here that sent this in. Just checking a couple of notes. This is for Robin as well. So Robin, can you comment for those community members out there that need to come in for regular care but are a little hesitant or nervous, or some of those elective procedures and are just nervous about coming in, what would you say to them, or what advice would you have?
Yeah, absolutely. That's been a question we've been answering throughout this whole time. And certainly at the beginning of the pandemic, it was definitely that we were really encouraging people to wait if it wasn't something that was urgent. And again, like I said, we tried to do a lot of those video and telephone visits. I would say that certainly in the facility that I work in, that I feel confident in the fact that we are doing strict screening protocols, and that our cases currently are not terribly high. And so I think I had actually encouraged a lot of my primary care patients to, come in so we could get things done. So in case we had spikes in our cases. So I do think that the healthcare systems locally have done a good job of, kind of separating those symptomatic patients from the well patients. That was a CDC recommendation at the early days, to really make sure that there's that division so we can keep people safe. And so I do think that it's very important that people get their regular care. If you have chronic illnesses, if you need procedures, those are still very, very important. So again, weighing those risks and benefits, if it's something that needs to be done, I would encourage you to, and it's definitely an individual conversation, and so that's something to discuss with your provider. But I would say that I do encourage people to still be coming in, because having a heart attack can be just as dangerous as COVID-19. And so we need people to make sure that they're taking care of themselves and taking care of those other underlying issues that they might have.
Okay. Our next question is from a parent. I'm going to open this up to the entire panel. What recommendations do you have for parents and guardians with regards to sending kids back to school, and where can they find more information?
I can take a stab at it. The one good recommendation for folks sending kids back to school is to, to be aware of what's going on in your community, to really pay attention to what's happening, and, heed the warnings. If you see signs or pieces in the paper or things in local media, to not let the world go on around you without you knowing what's going on in it. And really be be a citizen of that community, and really get to know what's going on. So if we're talking about college students, if we're talking about elementary school and high school students, call the school, ask questions, understand what's going on behind those doors, so that you have a sense of what's happening. And resources, I will never stop plugging the CDC website. One thing the CDC has really done well through this whole pandemic is they put a tremendous amount of information on their website, sometimes so much so that it's difficult to find things twice. But there's a ton of information out there and a lot of resources, and it helps direct you to a lot of other places beyond just them. So it's a pretty fantastic resource. If you haven't gone there and just perused it, it's worth the time.
The other resource I just want to add there is that there was a parent guide that we had on our website that I know a lot of the schools sent out, that I actually think, as a clinician, I think there's some really good information, because a lot of parents have questions about, my son or daughter has a runny nose, do I send them or not? And I think that there's some really good information in there that might help with some of that decision making that parents are questioning. So I would definitely check that out as well.
I would also add in that we have to think about our own behaviors and the impact on others. So in this time, we need to have a we society instead of a me society, and to think about that we need to rely on everybody to do their part, to stay home when you're sick, to be aware of what's going on around you, and play an active role, as Pete and Robin have said, play an active role in participating and helping stop this. We can't rely on just everyone else or the health department or our clinician. We have to be active members too.
Okay. Next question for the panel here. A question came in, COVID-19 seems like the flu. And what are the differences and similarities between COVID and the flu?
So there are a lot of similarities between the symptoms, but the difference with COVID is that it can be often affecting many systems of our body instead of just our respiratory system. So as many of you have probably heard reports about increased risk with the inflammation that has come, and the cytokine release, which is again an inflammatory cascade that's caused by this virus. That is something that we don't typically see as severe in flu patients. And so that makes it particularly dangerous, because it can affect many parts of our body, which is why there are the symptoms of abdominal pain, nausea and vomiting, why some kids are getting rashes, why headaches can be another one, why young people were having strokes that we didn't understand towards the beginning of this, why are young people having heart failure and heart attacks. That was, again, that inflammatory response that's created by this virus, which makes it that much more dangerous than the flu. And so there's definitely some differences that make the significance of this illness a bit different than the flu, which of course can also be dangerous, but we've seen definite differences with the COVID-19 illness.
Great. Thank you, Robin. I'm curious to hear from each of the panelists on this question here. What's the single biggest challenge that you faced during COVID-19? Is it PPE, containing the spread of the virus, testing, contact tracing, thinking ahead to vaccines, preparing for something else? Can you each comment briefly?
I can start because mine's pretty simple. The biggest problem, I don't want to call it a problem, but the biggest hurdle we've had throughout this entire pandemic has been misinformation. And that's largely due to, well, there's a lot of factors, but social media and just ideas and concepts that aren't completely right, or in some cases are completely wrong, that just take off like wildfire and aren't grounded in science. And they can be really destructive and make the work of public health and some of the really basic, like I call them old school public health interventions, how it can make things that are so simple so difficult because there's just a lot of misinformation or a lot of misguided distrust of the system, so to speak. So that's been one of the biggest, if not the biggest, hurdle to local public health departments.
Great.
From the university perspective, I would agree with that. The misinformation and the difficulty in being able to understand the most recent information as well, and understanding that why we're asking for the information we're asking and the decisions that are going into that, and being able to, it's very, very difficult. There's so much information out there, misinformation as well as changing information, that for everybody to be able to know what's going on and understand and be able to cooperate.
Yeah, and I certainly agree with Kelly and Pete in that, but I would also say what's really been highlighted that I've seen, whether it's my work with the health department or my work as a clinician, is just how to disseminate information in large scale, quickly, that's factual, that's based on research, that's but it's also, you're not getting different messages on different governing agencies. That, I think that creates some challenge, because then there's confusion. And so I think just how do we get messages out, and again combat misinformation, so we know how to proceed with the best guidance that we have. I think that's definitely, but as certainly on the clinician side, I would still say certainly treatment and testing are some of our biggest challenges that we are still facing.
So Robin, a quick follow-up question with testing. It seems that people talk about getting test results. Sometimes it takes a week to get the results back, and then you hear, I got my results back in 24 hours. Why such the difference there?
So due to limited capacity and testing sites and the ability to get swabs and the ability to get reagents, there's a lot of pieces that go into testing. And because there's not, we're doing PCR testing, which is a costly and time-consuming process. But what we've had to do in order to determine testing is to stratify. So someone who's hospitalized, who's having acute respiratory failure, who's on a ventilator, we need to know if they have COVID as fast as possible. And that person's test needs to take priority over an asymptomatic test. And so what we do as clinicians is when we have a case or a test that we're going to run, we actually have to set a priority number to it. And based on that is how the lab is then tested. So the lab tests the higher priority ones first, and then has to test those lower priorities. So for example, an asymptomatic patient who's had no known exposure to a positive would be a much lower priority than, say, again, that hospitalized patient. So that is one of the biggest reasons why there's such a difference in how quickly people are getting testing results back.
Okay. Thank you, Robin. A really good question came up here. You know, we're trained to think about good hand hygiene, staying 6 feet apart, wearing masks, avoiding large crowds. This question came in, which of those is the most effective? If you only had to do one or two, what's the number one, number two things to do?
I'll start. So I think one of the key messages is that it's not one or the other. It's layering them all on top of each other. That it's staying farther apart from people physically. It is keeping up with your hand washing. It is wearing a mask, because there are different ways that the virus can spread. And so we need to address all those different ones. Part of the difficulty is that we've never had large scale testing to see how well masks work. This isn't a typical randomized control trial that you might do in a laboratory setting. So it is difficult to measure, and for the most part, we don't want to take the risk of only putting one thing in place. Hand washing's been studied for quite a long time, and we do know that in general respiratory diseases, so this is not COVID-19 specific, but in general for respiratory diseases, adequate hand washing can reduce in a community setting, can reduce the probability of having a respiratory disease by at least 20%. So there's a pretty significant impact of hand washing alone, but that doesn't affect the transmission that would happen person to person through direct aerosol spread. And so that's where the masks and the respiratory hygiene and staying farther apart are critical to include as well.
So Kelly, to extend upon that, what advice would you give a community organization, a student organization, for example, that did need to hold an event in person and not virtually?
Well, I'd say that you need to be at least 6 feet apart from everybody at all times while you're in there. Everybody needs to be wearing a mask, and you should have your hand sanitizer with you to keep your hands clean before you're touching anything. And you should be using proper respiratory hygiene, so don't be coughing without covering it up or sneezing. And if you are sick, you shouldn't be at that event to start with.
Okay. Our next question is for Pete. Pete, aside from COVID-19, the Western UP Health Department does offer a number of other critical resources and programs for the community. Can you just comment on those, and how are those impacted right now during the pandemic?
So early on, a lot of these programs were shifted, and some of them were shuttered, so to speak. Like our WIC program, Women, Infants, and Children, those WIC benefits, they're an important piece to our community. And we went through a very long period that's still not over yet, where we just simply, rather than bringing the kids in, checking on them, going through the normal procedure, we just re-upped their benefits without even seeing them. WIC is set to reopen, I believe, on October 1st. There's a lot of other programs. There's community outreach programs that we do in the schools that were closed because the schools went out. We couldn't do our substance abuse education. We couldn't do our healthy eating and our activity education that we normally do. Our environmental health staff, the restaurant inspections, a lot of those weren't being done at the peak of the, they weren't being done in the same manner. There was a different style of inspection. It was more of a compliance check. So there's a change in a definite drop off in a lot of other services. Our building is still essentially locked. You have to have an appointment to come in. Hearing and vision screenings just started up again. So we're really doing our best to re-engage the community with a lot of these programs that we desperately need to get back into the community. But we're trying to do so in a safe manner. And childhood vaccinations is another one. We saw a big drop in vaccine rates during the during the peak of this thing, because we didn't have availability. Doctors' offices weren't seeing kids for those routine type visits. So now there's a lot of catch up going on. So we've been doing a lot of that work, trying to re-engage those programs. So those programs have certainly taken a hit. We've done our best to keep the regulatory programs that needed to be continuing, but a lot of those other community programs did take a back seat to COVID.
Okay. Thank you, Pete. The next question here, I think is pretty straightforward. It's asking, where can we find the latest information on COVID-19? Should we go to our local health department website, the CDC, the MTU, Michigan Tech website? Where is sort of the go-to place to get the most up-to-date information? This is for the panel.
I'd say it depends kind of what you're looking for. I would say kind of a variety of things. So the CDC, as Pete said, has extensive amounts of information that would be generally guiding a lot of our state and local health departments. But the CDC is not where you're going to go look to find out about Houghton County. So again, if you're looking more for your local information, which is really important to stay up on, so you know how many cases are out there, what's going on in our schools, what's going on in our economy locally, that would be directing people to the Western Upper Peninsula Health Department website. There's also really good information on the state website that has some good maps that does do case counts and cases per million and things like that, that are measures that we follow in order. So that would be, and then of course, like for the schools, you'd want to look at your own schools websites, and like Michigan Tech or Finlandia, you'd want to definitely check out the school's website so you kind of know what are their policies, what's changed there, what's new to be updated. So definitely just to kind of depending on what you're looking for would kind of determine where you go.
And I would add in there that as you're looking at different websites, so there are, again, thinking about the misinformation, there are lots and lots of other websites that are available, but you need to be a very conscious consumer of that information. Look at where their information is coming from, and really assess whether that is trustworthy information if you're not looking at these sites like our CDC, the state, or our local health departments.
Following up here on a question, this would be for Pete. So this community member, Pete, says, I've looked at the Western UP Health Department and looked at the number of cases, and that seems to be just slightly different from the state, the michigan.gov website. What's the reason for the difference or discrepancy?
It can be a couple things. So the primary reason you'll see a discrepancy from a day-to-day basis is timing. The state grabs that data at a certain point during the day, and then the health department, when we push our numbers out, they usually come out 6:30, 7 o'clock in the evening. So the numbers that you see on the grid from the health department come out in the evening. The numbers that you see from the state website get snagged at about 10 a.m. So just in that 10 a.m. to 7 p.m. period, there can be cases that come in from the laboratories. The cases flow in all day long. So there's always going to be a couple cases difference here and there. And then throughout the course of a day, there's also cases that get pushed to other counties because perhaps the person doesn't live here, or we picked up a case from another county that got pushed to us. And then there's also, the state will grab onto things because they just kind of do a data dump and it doesn't get checked and kind of ran through. So there is just some errors, frankly, that come through as well. And we clean those up. So our data that we push out on Mondays and Thursdays is going to be the most comprehensive, cleanest data that you're going to get. But the state website puts it into all those other graphics, and they do a lot of really neat things with it. But the two are never that far off. But those are the basic reasons why you'll see some differences in the two.
Okay, Pete. Our last question for the panel tonight. This is a really good one. I'm glad we're ending on this one. So eventually we'll get through the COVID-19 pandemic. We're very curious, what can we learn from this and apply potentially to help us prepare for the next health crisis in the future?
So I'll cheat and try to go first. I think what we've learned from this pandemic, at least for me as a public health professional, somebody who's done a lot of different things in public health for quite a while, is that you can't ever get away from the basics. And this thing has taught us that the simplest interventions are the ones that are the most important. And your ability to communicate and to educate and to do some really simple things, when you really look at it, are what's going to get you through these things when you have no technological or pharmaceutical solution. So we can't ever lose sight of kind of these old-fashioned interventions, because that's essentially what's gotten us to this point thus far, is just old school public health.
I would hope that we learn how to communicate with each other about health issues, and how to be conscious consumers of health information and be able to take that forward, and understanding that just because we don't see a disease doesn't mean that public health isn't working. It actually means that it is working because we're not having the outbreak. So the prevention is there. I would also second Pete's comments on the simple things. As someone who did their PhD in hand washing works.
And then finally, Robin?
I would just add, I mean, I completely agree with both Kelly and Pete. And I would also say that certainly from the healthcare world that, you know, we are having to learn how to adjust very quickly, and that we learn, you know, when we need to make changes and not, you know, wait for a lot of policy and bureaucracy in order to make the changes that we need to address kind of the fire that's in front of us. And so just learning lessons on how to be kind of more accurate and more quick with some of these changes that we need to be making to adjust to what's in front of us. I'm hoping that we see some changes there.
Okay. Thank you, Robin. As we start to wrap up here, I'm going to bring Kelly back in. So Kelly, you know, we really focused on the role of public health to protect the community. Next week, we're going to be talking about our preparedness and emergency response. We're going to have officials from the Houghton County here, as well as administrators from both UP Health Systems Portage and Aspirus. Can you give us a preview of some things that we might be thinking about for next week?
So oftentimes our local preparedness is what we call all hazards preparedness. So they're looking for whether it's a natural disaster, a health disaster, or some other kind of disaster. And so I'd like everybody to kind of think about how they can, how these different positions are dealing with thinking about preparing for any kind of emergency or hazard, how they can quickly switch between different hazards and be ready for anything that comes, because we don't know what will come.
Okay, Kelly, we look forward to that next week. It'll be Thursday at 7 right here on the Zoom webinar on 97.7 The Wolf. Again, we just want to thank our community partners and our campus partners, UP Health Systems Portage, the MTech Smart Zone, and Upper Peninsula Power Company. And again, the town hall was presented by UP Health Systems Portage and really organized by the Health Research Institute here on campus. Thank you to Dr. Karen Helt, for the director of the Health Institute, and our presenters tonight, Dr. Kelly Kam, Robin Meneguso, and Pete Berry from the Western UP Health Department. We appreciate all of you tuning in tonight. The recorded session will be posted on the mtu.edu website. Thank you, everyone, and we'll see you next Thursday. Stop recording.